Hello again, this is Dr. Tony Madril with another 3 minutes for your mental health. In this video, I'm going to be answering the question, how might trauma therapy help me to recover from the effects of transgenerational trauma? If a person believes that the parenting they received in childhood may have been compromised because of transgenerational trauma, they may choose to work with a therapist to identify the specific developmental needs that were missed and may now be linked to the relationship problems they're experiencing as an adult. For an example, a person may not have felt seen or heard as a child because their parents were overwhelmed by trying to manage their own trauma symptoms, distracted by marriage problems, and the stress of having to care for other children. To cope with the unbearable reality of having an emotionally unavailable parent, the child may have developed ways of enduring the stress by engaging in repetitive fantasy to dissociate from the stressful situation, which may now be linked to difficulty in developing secure relationships with others. As you might know, there are several research-based therapies to work with trauma, and in this case, the therapist might choose to first intervene by introducing one called ego states therapy to help the client locate a memory that best represents what it felt like to feel alone as a child, and then to use that image to imagine themselves asking that younger part what they would have preferred to receive from their caregiver rather than what actually happened. Perhaps they might discover that they would have wanted to receive regular hugs from their caregiver, to see their caregiver lovingly gaze into their eyes, and to hear that they were loved unconditionally. Equipped with this insightful attachment-based information from the client, the therapist can choose to offer them the opportunity to participate in a therapeutic exercise wherein they are guided on how to create what's called a meeting space in the mind, which is an imaginal vehicle for the client to begin to connect emotionally to that younger part of themselves that still exists with unmet emotional needs. Within the imaginal meeting space, the client can use the image of their adult self to begin to relay important messages to that younger part, such as nurturing messages like, "You are not alone anymore, I'm here for you," as well as images of that child receiving their physical affection. This may help the person begin the process of developing more secure attachments in their adult relationships. If you would like to learn more about best practices for trauma treatment, please feel free to subscribe to my YouTube channel or visit my website. Thank you.